Welcome to Identity Unboxed, where we provide mentorship and promote representation for Black professionals in the advancement of the Black community.
We are seeking guidance from exceptional Black leaders, scholars, and professionals with expertise in their respective fields.
We hope to foster a space that promotes authenticity, inclusivity, and restoration for our listeners while exploring the intersection of our personal and professional lives.
This project is a culmination of our lived experiences as young Black professionals to transform our life trajectories, to overcome adversity and reach triumph.
Our intention is to inspire you on your path to discovering your purpose. All right. Well, welcome, Dr. Wako, to Season 2 of Identity Unboxed. We are so grateful to be here with you, to hear about your journey, and for you to share your expertise in navigating the medical field and also earning your MBA. You are currently the president and CEO of Swedish Health Services and took that position in May 2023. And then you also have made history by being the first woman and African-American to lead the organization since its founding 114 years ago. And today our conversation will be about being Black in medicine and also your route to the C-suite. And our first question for you is, with over 30 years of experience in healthcare, can you take us back to the moment that you decided to pursue a career in medicine and how your identity influenced the direction that you crafted your career?
Right. Well, first, I want to say thank you, Tiana. Thank you, Brad, for having me on the show. I'm excited to be here and share my story. Hopefully, someone out there finds something meaningful in what I have to say. So thank you for giving me the opportunity. All right. Okay. 30 years of it makes me seem like I've been around a while, which I guess I have. I've been in healthcare a very long time. So when did I decide to pursue a career in medicine, and how did my identity kind of influence that path for me? So I immigrated to the United States when I was 3 months old. I'm originally from Ethiopia. We immigrated with a green card, which, is not that common. And the reason we came with the green card is because my mom was a nurse, and my father actually came to get a master's in theology, and that's how we found ourselves in America. Now, the intent was always to go back, but politically, many things changed in Ethiopia in the short amount of time that we were here. And we kind of found ourselves staying in America. And then if you fast forward many, many years, we were living in Walla Walla. And my father was a tenured professor at Walla Walla College. My mom was an ICU nurse at the VA in Walla Walla. And I was finishing high school and trying to decide what I wanted to do. And so, it would have probably been academics or medicine. And my mom's career clearly won out because I went to nursing school. And while I was in nursing school, I actually made the decision to go to medical school. And it was really in response to my sister. So my sister's a year older than me, and she had been sick a majority of our teen years, probably from like 13 on. And my mom had continually taken her to different physicians, many different physicians, to try and figure out kind of what were all of her symptoms and why was she feeling so bad. And remember, my mom's a nurse and an ICU nurse at that. So she, really understands medicine. And many, many doctor's appointments, very few solutions. And really, she was told that her symptoms were due to the fact that she was overweight. So when we moved to Walla Walla, my sister and I were both enrolled in school, and my sister went to establish herself with a primary care doc because, clearly she had a need to see physicians. The funny thing was, I remember I didn't go find myself a primary care doc, but she, had to. So she went and found a doc. She found, I think probably somebody who had recently graduated from residency, so young in her career, a woman, physician, family medicine doc, and went to go see her, sat down, and shared her story with her. And in that first meeting, she looked at my sister and she said, oh, I think I know what's wrong. And she did additional tests and was proven to be correct. She had and was diagnosed with Cushing's disease, which is a tumor on your pituitary gland that's constantly secreting steroids. And one of the major symptoms of that is obesity because of the steroids. So really kind of watching that process, watching kind of everything my sister went through and realizing that the solution to all of her problems really came from that physician interaction. That is really when I made the transition to say, I want to go to medical school and I want to be able to make a difference in people's lives in the same way that a physician does. And so that is really what started me down my path.
Wow, that's amazing. There's nothing scarier than hearing that a loved one has, an issue that really negatively impacts their health, especially if it's a tumor or something like cancer that, puts that fear in you that, oh my gosh, is this person that I love going to be here? So it's amazing that you took that and said, hey, this is something that happened to my family member, and I want to be able to be that person that, is kind of some people saving grace in a way that lets them know of their issues so that they can get better and healthier. So.
You're so right.
Thank you so much. That is so inspiring. And you also touched on the point of how many women of color dismissed in healthcare. And so to see that you're now that representation and you can really understand women and their health in a holistic way is amazing. So thank you for sharing that. And I was hoping you'd be able to dive a little bit more into that path when you were attending nursing school and then when you decided to go on to medical school. Did you have any particular challenges that have been memorable for you that were significantly impactful or pivotal in your life?
Challenges. Well, I mean, the whole process is challenging. I'm not going to lie. Medical school is, probably challenging by definition. And, I guess what I would say is it takes a significant amount of drive and determination to make it through that process, just because it's incredibly long. You have 4 years of medical school, you have 3 to 5 years of residency training, and the entire time you're in training. So we're talking, 8 to 10 years of your life that you spend working towards one outcome. And it takes a lot of focus. It takes a lot of direction. And I would say that the number one thing, the first thing is really being clear about your goals. And it's probably not going to be medical school, but any goal that you have. And the hard thing about being kind of a high achiever is that you really have this fear of failure, and you fail if you commit to something, if you verbally commit to something and then you don't achieve it, right? So I think sometimes, those of us, that are high achievers, we almost don't commit because we have that fear of failure. So I would say probably the most important thing is really defining what your goals are and setting them. So your 2-year goal, your 5-year goal, and your 10-year goal, and then verbalizing it, because verbalizing them and kind of speaking them into existence will focus your mind towards achieving those goals. And then, like every person that's walking down a difficult path, but more so, I would say, if you are a minority or a woman, you really need a mentor. And I would say more so because you're less likely to find that naturally, and you're less likely to find that in your peer group, just because there just aren't that many like you. And the interesting thing about mentorship, friendship, any ship, is that you tend to align yourselves with people that you that look like you, have similar experiences that you, just because I think that's where our brains are naturally inclined to go. So you have to actively work against that. And your mentor might not be somebody that looks like you. They might not be the same sex you are. But it's really finding somebody who really is invested in you and in your success. And that's why I think it's important to be clear about your goals, because when you're clear about your goals, it directs you to somebody who is going to help you achieve those goals. But if you're quiet about your goals and you don't share those, then you run the risk of having a mentor, having somebody that's supportive, but not somebody who can get you where you want to be in the end. Because your mentor can also connect you with other people who can be your mentor. So I would say that's probably the most important thing you can do, is clearly define where you want to go and then find people who are willing to support you along that path.
That was wonderful advice. Thank you so much. I wanted to ask you some advice on finding balance within that, because something that I and others experience is, when you are so ambitious and goal-oriented and, sometimes you get ahead and looking into the future too much. So you start planning out these goals and where you want to be, and then it kind of distracts you from actually living in the present and being like, wow, this is where I am right now. This is where I've gotten, because you're always focused on that goal. So can you give some advice on, making those long-term plans, but also staying grounded and keeping present?
Oh, I mean, that's a hard one. You called it. It's not easy. Sometimes I always joke that I live somewhat in the future. So I like planning the party. But then when it actually gets to the party, I'm too busy planning the next party to enjoy the actual party. So that takes effort, true effort. Like, you have to think about it. This is our life. Like, the day-to-day is our life, and every single day is challenging. Every single day is hard. And I think many times we find ourselves in the position of saying, oh, next week will be easier. 2 months from now, it'll be easier. Next year will be easier. When I'm a junior, it'll be easier. Like, all of these things are very futuristic. But life isn't in the future. Life is not in the past. Life is in the exact moment that you're in. And you have to remember that these moments, don't wish them away. They're your life. And so they tell you to do centering things, right? If you've looked into it, if you have this problem, you might have looked into it. And then they try to get you to, focus on the environment you're in. And this is from all my psych work. Call out things that are like in the room. I don't know. You guys might be too young, but do you remember Goodnight Moon? Do you remember the book Goodnight Moon?
Yes,
It's a child's book. Yeah.
Yeah.
Where, they're going to bed and it's kind of very, it has a rhythm to it. I used to hate that book. Like, I didn't understand why kids liked the book, but I would read it to my kids. And what it does, which it took me many years, it actually took me during COVID to figure it out, because COVID was so incredibly stressful. And people were having a lot of difficulty living in the present, that it was then that I realized that what that book does is it calls out things in the room, and it tells you to focus on the things that you can see and the things that are around you, to keep your brain from trying to go to the future, from trying to not live in the present, from trying to think about, what do I need to accomplish tomorrow? What do I need to accomplish next week? So I guess what I would say is, if you find yourself with that problem, you actually have to make an effort to focus yourself in today. And when you feel yourself starting to drift and losing the moments that you're in, or the conversations that you're in, or not appreciating, just the day-to-day interactions, then you really have to take some time and center yourself. And even if it means putting an alarm on your phone to focus you on centering yourself, or even, centering yourself with a conversation before you start driving towards that goal, right? Sometimes I just want to get on the phone and I want to answer the question, but take a moment, pause, see what's going on in their life, share what's going on in your life, appreciate the moment before you run to, trying to answer the question. So Brad, I don't know. I don't know if that was helpful. It's the best I got though.
No, it was helpful because I feel like that's just the challenge in the journey is, learning to plan, but also centering yourself when you feel your mind, run through that rabbit hole or, trying to run too far ahead. So that was really good advice. Thoughtful planning, but stay grounded and stay centered and have those mindful practices when you need them.
Yeah, I love that. That is so useful and very relevant for me too, because I'm similar to where I'm always looking about where I want to go instead of being intentional about absorbing the current moment and also recognizing what you have accomplished. I think sometimes when you are so high achieving, you kind of forget about all that you've done to get where you are currently. So that's always great to think about in retrospect. And transitioning a little bit, Dr. Wako, could you talk a little bit more about your journey to earning your MBA? What led you to do that? And then also, how have you balanced your route to the C-suite with being a mom of 4? Because I'm sure you're very busy. And I have no idea how you're doing that.
Okay. Balancing or making my way to the C-suite, making my way here, and then having children along the way. Okay, they're a little separate. So I'll tell you about the having the children part. So the having the children part, well, that's easy. I think you while you're setting your 2, 5, and 10-year plan, don't just make that professional goals, make those personal goals also. So think about kind of how you want to live your life. Somebody told me once, and I actually think is really good advice because I do actually use it, is when you're making those 2, 5, and 10-year plans, try to visualize a day in your life in those moments, right? So visualize what a day in your life looks like in 5 years. And really visualize it. Like, get up in the morning. What do you eat? What are you putting on? Where are you? How are you going to work? Like, try and make it as specific as possible because it helps focus your mind, and it also helps pick up the ancillaries, like pick up other things other than just thinking about the end point for your career. So if you're envisioning yourself being in a home and having a significant other and having children, then that's part of the goal also. And the thing about having children is they're never convenient. There's never any single moment in your life that is a good time to have children. If you're waiting for that, it's just never going to happen. So if you want them, you have to throw them in the plan too and kind of find a way to do both. And so it is very difficult. 1 children, 2 children, 4 children. 4 children are a lot. They are a lot, but they're worth it. And I always think that, there's many things that I may regret in my life when I get to the very end, but I will never, ever regret my children. They bring me a lot of joy, and they center me in so many ways. Now, that kind of high achiever personality comes out of home too, because it doesn't go away. It just stays with you. And what I've noticed is that to stay sane, myself to stay sane, the family to stay sane, is that I really just have to accept 80%. Like there is no 100%. It's so hard to get to 100% of whatever it is I want, that 80% is good. 80% is great. Don't beat yourself up if it's not 100% of what you want. Like whatever it is, the house being clean, the children being dressed, like all of it. 80% is fantastic. I mean, most of the time it's really hanging out at 50%. So 80% is good. So why are you beating yourself up for 100%? And I found that honestly, that's probably given me the most peace in trying to manage the chaos of the career and the children. So that's my best advice there. Okay. The second part, which is how did I get to being a CEO from being a physician? Was that what you're asking, Tiana?
Yes. Yeah. What was that path like? And then also about earning your MBA, like kind of your decision making behind that. Did you feel like that was necessary for you in order to get the position you have now?
Okay. Yes, I did think it was necessary, but let me backtrack a little bit. So I finished medical school. I was practicing as a physician, practicing as an anesthesiologist, which I loved, by the way. I loved doing clinical medicine. There's nothing like the physician-patient relationship. It is so fulfilling, unlike, I don't know, nothing I probably have ever done and probably ever will do. So that part of my life, I really took care of patients one at a time, which was lovely. And when I myself would walk in the room and I would be taking care of a patient, and the thing about anesthesia is you don't ever know who your anesthesiologist is going to be. They just show up the morning of surgery. And when the patient was Black, and they would look at me like the stress, the sense of relief, it was just like, it was palpable. I could see it in them. And they didn't know anything about me. They didn't know where I went to school. They didn't know, what residency I went to, how good of a clinician I was. It was simply the fact that I was Black. And it is just, I think, says something about the amount of stress that we carry being African American in a healthcare system that's not. And you're questioning about whether or not you really are getting the best care, or that somebody is valuing you as a human being. So that just being able to give that relief to somebody, I miss that. But what I learned, so this is what I learned in the process, is in addition to being an anesthesiologist, I also did a fellowship in pre-op medicine. So I was the medical director for the pre-op clinic. So I set up kind of the pre-op work that needs to happen before surgery. So I had a role kind of outside of the operating room. And when I moved from the university system to the private system, they asked me here at Swedish to set up the same system in our hospital. And that got me kind of out and about in the hospital. I got to meet lots of clinicians, lots of administrative leaders. And at the campus I was at, the First Hill campus, which is the flagship campus for Swedish, the chief medical officer role came open. And when the chief medical officer role came open, honestly, I thought, well, that'll be a really great role for me in like 10 years or 20 years, or maybe end of career, because most CMOs are at the end of their career. And I just kind of put it aside. But one of the other physicians, he was actually the chief medical officer at the time. He was transitioning to a new role. He reached out to me, and we actually had a meeting about the pre-admission clinic. And at the end of the meeting about the clinic, he said to me, "Hey, Elizabeth, have you thought about applying for this role?" And I said, well, no. I kind of thought that, it would really be for somebody who was much later in their career. And I'm a little early in my career and haven't, I feel like I've done enough to demonstrate my ability to lead in that way. And he said, no, I really think you should consider it. I think you're exactly what the organization needs. So surprise invitation to apply for a role that, I had looked up to and felt was quite prestigious. So I applied, and I got the role, and I was in the role. I don't even think I was in the role a year. And I had this idea that as the chief medical officer, I would really be able to change the direction of the choices we made regarding how we administer healthcare. And what I found out is that as the chief medical officer, I gave my advice to how things ended up. But it really wasn't my decision how things ended up. And the person who was actually making the decision was the CEO. And to be able to get into the role of the decision maker, then I would have to go back and get an MBA, because there was a whole other facet of my training that I felt would be essential. Because the CEO is ultimately hired by the board, and there's, expectations that one would have for the CEO. Not all CEOs have MBAs, but it's certainly helpful as a CEO to have an MBA. So I went back and got my MBA, and I finished my MBA and, set my goal that I wanted to be the CEO. And it's really funny. told my boss, who actually had my boss was a clinical boss, and then I had a boss that I kind of dotted line to who was operational, and I told him that I wanted to be a CEO, and to go down that path, I would probably go down the chief operating officer role before the CEO role. And I said, I have a goal of doing that within 5 years. 5 years from when I took the chief medical officer role. And so we were approaching the 5-year point. And I remember there's, I don't know, maybe 3 months left in my 5-year. And I went to go see him, and I told him, I go, you know what? I said that I wanted to be in this role by 5 years. If I don't transition to operations, then I will be in a clinical role probably for the rest of my career. So I'm going to start looking outside of Swedish. So I started looking for a role in California. Well, I didn't start looking in California. It just happened that there were 2 roles that came up in California that the recruiter reached out to me for. And I started the process of gathering information, interviewing, sending my info to the board, and to the leadership teams, and was about ready to go out on the interview. And they did a restructure in the organization, and I got the COO role at the First Hill campus. So that's how I ended up here. Then pretty quickly after that, once you're in operations, you start moving down that path. So I was the COO, then the COO for more than one campus. And then I was in the previous CEO's succession plan. And when he left the organization, then it was really easy to transition into the CEO role. So that's how I ended up here.
That is so amazing and inspiring. And I'm so glad you had someone encourage you to actually apply for the role, because it seems like you were qualified initially for that chief medical officer position, but maybe you had kind of discounted yourself, like subconsciously. So being able to have someone encourage you is really amazing. And also, I was hoping you could talk a little bit more about how your leadership philosophy has kind of developed now that you've had many of these pretty prominent leadership roles, and kind of what you think a successful leader needs.
All right. A successful leader needs. Well, okay, I can't speak for all leaders. I can say that in healthcare, you need empathy. And I would probably say in most fields, you need empathy. So you have to be able to, I think, relate to those around you. You have to be able to relate to, we say caregivers, other industries would say employees. And then you have to be able to relate to those that you serve, whether it's your customers or your patients. So I think empathy is very, very important. The other thing is, you need leadership skills. That seems kind of vague, though, when I say it. Like how do you tell somebody to go get leadership skills? But it's kind of a broad range of being able to carry many truths at the same time, because rarely ever is one truth the real truth. And I think that took me some time. That took me some time to understand. And it's true in leadership, and it's also true in life. Many truths can exist at the same time. And your job as a leader is to try and find the truth that serves everybody. And it's difficult. It is definitely not easy. You pull in, I think, all of your life experiences unconsciously. And in many ways, I think that's probably what makes me a good leader. I think I'm a good leader. I think I'm the right leader for the organization today. But it's because I was a nurse, and I was a physician, and I was a patient, and I have experiences as a minority and experiences as a woman that I think all tie into my decision making that I trust. So I trust the decisions that I make. And I think others trust the decisions that I make for the same reason. So it's kind of having the right experiences for the role that you're in so that you truly can lead as an expert. So I think that's really important. I don't know. Those are probably a little vague. I don't know how helpful they were to you.
No, I think they are. They are helpful. And like the empathy, I think, is so important in many aspects to hold, and also understanding all those unique qualities that you bring based on your identity. Like you talked about, you think you're the right person for the role because of what you've experienced and how you've navigated your life. So I think that is very valuable.
Absolutely. I think centering empathy, also having expertise in what you're doing, and also having confidence in your decision making. You know, when you aren't confident in your decision making, that might waver people's confidence in you. And so being able to show up with that level of confidence is amazing. And I think that leads great into our next question. I was hoping you could dive in a little more about your journey as the first woman and Black American to lead Swedish Health Services. And if any, can you describe the challenges you faced as a woman in such a prominent leadership role, and just how your identity factored into that?
Okay, that's a lot.
Yeah.
All right. Well, so I definitely feel honored to be the first woman and the first Black person to lead Swedish. Swedish is an amazing organization. And I think it's important to note the organization has to be ready for you. And that took work that may have involved me, but didn't really involve me, right? The previous leaders, the members of the board, the community, there has to be a desire for variety and leadership that exists before you get into that role. So I can't take all the credit for that because that happened before me. I had the benefit of being part of an organization that was readying itself, right? So I think that's a good thing to note. You should look in the organization that you're at and look around in the organization that you're at and be honest with yourself about whether or not this is an organization that is readying itself for you as a leader, especially if you're a first. And if it's not an organization that is readying itself for a leader, it is less likely you're going to be able to force your way in and make that happen. So I think that's pretty important. And then, what are some challenges as a woman? Is that what I think the other question you were asking? There were a lot of questions in there, so I don't know if I remember all of them.
Yeah,
but challenges
as a woman,
go ahead.
For sure. Yeah, challenges as a woman and just as a Black woman in the space.
Mm-hmm. Okay. Well, the challenges are that you really have to. I think you have to be confident in yourself. You can't be relying on other people to tell you that you're wonderful, or other people to tell you that you're amazing, or that you have great decision-making skills. By the way, I would say that's kind of in general about this role. I got way more positive feedback as a physician every single day than I've ever received in this role as a CEO. You get your positive feedback like at the very end when something huge is accomplished, right? But that's like 5 years down the line. So you can't be the type of person that's waiting for people around you to give you accolades. You really, it has to come internally, and it has to be an internal drive. But the second part of that is you can't be surrounded by people who aren't, supporting you. So once you're in the role, you really have to look around and make sure that you're building a team around you of people that support you. And when I say support you, I definitely do not mean people that agree with you. I mean people who support you and are and are wanting to help you become a better leader. You need people around you who are going to tell you the truth. And as a Black woman, I have to really look and make sure that the members of my team, your social network outside of your role, that the members of your board are aligned and support you in your vision. So I guess I can't emphasize that enough, to really look at your network, look at the people around you, and look for people who are going to push you, people who are going to make you better, but who ultimately want to see you succeed.
That's great. And just very valuable advice again. Could you talk about a little bit more how you built up your confidence and like self-efficacy? It sounds like, you've been so determined and strategic about how you've crafted your career. And when you are one of the only people in the medical field and in these spaces, how did you kind of build that confidence up? I know you talked about mentorship, but is there anything else that has helped you kind of feel like you're able to do whatever you set your mind out to do?
That I am enough. Well, I don't know. That's a hard question. I would say I've probably always been this way. So I think some of it might be in your DNA. And then a lot of it is probably just in having your family and having the support systems around you, right? So my parents have definitely supported kind of every decision that I've made along the way, and, really, have always been there, and things haven't always worked out. Like there's many things that I thought that, that this was the path that I was on, or this was the direction that I've been on, that I've had to change, that it seemed quite drastic at the moment, but in the end, ended up getting me where I needed to be. So I think it's back to the people surrounding you, the people closest to you. So definitely my parents, definitely my husband, who, when things looked like they were going south, were still willing to stand by me and know that in the end we're going to get there. And then it's so life is hard. It's not fair. It doesn't go your way 90% of the time. If you are walking around expecting it to be fair, expecting to get what you deserve, that's just not going to happen. You're setting yourself up for disappointment. You really, you can only control what you can control. And so when life is just like turning you down, you want it to go right, and it is definitely taking you left, you have to redefine what left looks like, and accept it, and move on. And that can be really hard. And it's also really hard when you think you were right about something and you were wrong. You thought that you were making the right decision, and then you find yourself there and you find yourself unhappy. So I think you have to have the courage to say, I was wrong, and I'm going to change it. I'm just going to change it. And that can be really hard, and it can be really scary, because I think sometimes sticking with the status quo is really easy. So when I started medicine, I was going to become a surgeon. I wanted to go into general surgery. Well, general surgery, and then, who knows, you can specialize from that. But that was the path that I was on. And it was a really hard decision to make a complete change and say, you know what, this isn't how I envisioned living my life. I think I would be better in a different specialty. And that was because, by the time, I started my general surgery residency, I was already married. I already had my daughter, and I could envision what my life would look like as a general surgeon. And that wasn't the vision that I had for myself. So I had to stop and make a transition to anesthesia. And switching mid-residency is not common at all. There are very few people that switch mid-residency to a different specialty. So sometimes life leads you on a path, and you got to take some risks. And it turned out in the end, because it's much easier to become an administrator being an anesthesiologist than it is to become an administrator being a surgeon, because when you're a surgeon, your patients are your patients. Like, you have a referral base, people are referring to you. But when you're an anesthesiologist, you take your patients as come. So if you decide to go try administration and it turns out you weren't a very good administrator, you can always go back to being an anesthesiologist, right? But it's much more difficult to going back and becoming a surgeon. So I don't know.
No, that's really great. Yes, very helpful. It sounds like just being honest with yourself is very important, and then knowing when to actually reevaluate and adapt. So yeah, I think that's amazing. And just pivoting a little bit more into your career as a doctor, we were hoping you'd be able to speak a little bit about how Black women experience disparate health outcomes, resulting in shorter life expectancies and higher rates of maternal mortality due to the adverse impacts of racism and gender discrimination in healthcare throughout history. And according to a study published by the National Library of Medicine in 2021, 24% of Black women live in poverty in comparison to 14% of all women, while maternity mortality rates for non-Hispanic Black women are 3 to 4 times the maternal mortality rates of non-Hispanic white women. Can you speak to how the social determinants of health explain these statistics, as well as the importance of representation of women of color and Black women in healthcare? Please let me know if you need me to repeat anything. It was really long.
It was long, but the topic was the same. And it's quite shocking that in America, healthcare is not a human right. And I think that plays out in many ways in these, health outcomes. A person's zip code is much more of a significant determinant of their life expectancy than their DNA. I mean, think about it. That is mind-boggling. That tells you so much about what the social determinants of health are. And really what it boils down to, it boils down to access to healthcare. And while, and if you go back to my parents, I mean, this is the reason why I am committed to healthcare, and my other passion is education. Like, education is incredibly important. And when you look at those the minorities, African Americans, this entire population, is that if you don't have access to education, what it is that you don't have access to is income. That's the problem. It's not the education, it's the income that the education really brings you. And without income, you don't have insurance. Without income, you don't have really good transportation. Without income, you're living in areas that don't have access, that just don't have health care. There aren't clinics there. There aren't grocery stores that have really good food there. So that is a huge, huge component of it. And then I think the other side of it is kind of systemic discrimination. And it's really around the implicit biases that those of us in healthcare, physicians, nurses, providers, and those biases lead to miscommunications. And those miscommunications lead to poor decision-making in healthcare. And especially when you're looking at maternal mortality rates, like that time period is a very short time period of when you go into labor and then you give birth. And there are some critical decisions that need to be made. And if you do not have trust and faith in the person that is supposed to be advising you and making those decisions, then you're just not going to make the right decision, or you're going to delay in making that decision. And I can't even help you understand how significant that is, I think, unless you've experienced it. And the thing is that even me, who not only do I understand how a healthcare system works and how a hospital works and how clinicians work and, trained in medicine, when you're faced with a decision and you don't trust the other person because you don't know them, you don't have a relationship with them, they're walking in the room and they're asking you to make a critical decision, it is incredibly hard to do. And it's underappreciated how hard that is. So recently my father passed away, and he had a head injury with a head bleed. And it was in our home. He had the bleed in our home, and my mom took him to the emergency room. And I wasn't there. They live on the East Coast. I was over here. And so they called me from the emergency room and FaceTimed to make the decision about whether or not to withdraw care for my father. And so while I could understand the clinical picture, look at the scan, and it was incredibly difficult for me to make that decision, even with all the knowledge that I have, because I didn't trust the person that was giving me the information. So if I couldn't do it with everything that I have, how do we expect the average person to be able to do it? So you throw that in there with delivering, being pregnant, and delivering, and really being in a place where you're vulnerable and you're depending on the system to take care of you, and you're under this chronic stress of whether or not you're really going to get the best care, whether or not the system values you. How are your outcomes not going to be less? Of course they're less. That's why they're less. So, we've spent a lot of time as Swedish is a baby hospital, right? It's, if you're a Swedish baby, people will tell you that they are a Swedish baby and deliver more babies than any other hospital. We're in the top 10 in America of baby deliveries. We deliver a baby every hour, easily a baby every hour. So one of the programs that we've worked on here is a program called Just Birth, and it's for us brown women. So whether you're Black, African American, African, Native, BIPOC women, birthing women, and what we offer them doulas, and the doulas will help them through birth and kind of after delivery. They'll provide child birth education. They will be cultural navigators. And so when you come in the hospital, free of charge, you will have the opportunity to have a doula. And what the doula does is the doula acts as an intermediary between the patient and the staff. And the goal is to try and get past that gap in care delivery that we just, in America have not been able to get past. It's been an amazing program. I'm incredibly proud of it. And it's made a significant difference for those that have given birth here at Swedish since we implemented.
That's so amazing. I did not know that Swedish delivered that many babies, so that was news to me. But thank you so much for that. And I think moving forward to our next question is a great transition to, just reflecting on your career in a field where only 5.7% of physicians identify as Black or African American. According to the Association of American Medical Colleges in the 2022 Physician Specialty Data Report summary, how do you remain steadfast in achieving your professional goals?
So this question, if you kind of go back to what I was saying about making the transition from being a physician to being an administrator, I spoke a little bit to that, kind of missing that. And remember when I was speaking about kind of the medical mistrust that exists, and when I would take care of a patient who was Black also, just that relief. So I definitely felt a little bit of guilt. I mean, because there are so few of us. And then, I'm also now leaving the ranks of those that are delivering care. And so, and it was very much about kind of why I went into medicine, was to really be able to do that. And so now I'm leaving and I'm, becoming an administrator. So the opportunity that I have that I didn't have then is that then, I was really taking care of, one patient at a time. But now, kind of as the CEO of Swedish, I set the vision, the future, the direction for the organization, and we take, our responsibility to our community seriously. And as I said earlier, as a leader, you are guided by your experiences. In this role, I'm guided by my experiences. And those experiences allow me to make decisions for our community, for my community, on a much grander scale, because now I'm talking about what programs are we investing in, what programs are we closing. And those are huge decisions, more than just one patient at a time. And so when I think about kind of my influence and starting out and what I wanted to achieve, I feel like I'm able to do that as or on a much grander scale in this role.
Do you ever feel that, like, that a burden, or not a burden, but just that responsibility, knowing how you're in a prominent role and you are the CEO of this, of Swedish, just being the example, do you feel that burden sometimes?
Oh yeah. I mean, I definitely carry the weight, right? I'm also carrying the weight for any future African-American or woman leader, right? So, I almost feel like my success is determined on the success of every other Black woman that comes into a leadership role, right? So it's a lot. It is a lot of weight to carry. But nobody else is going to make the same decision I'm going to make. So even if, sometimes it's like one bad decision that takes you down, even if, something happens and I make the wrong decision and it takes us in the wrong direction, I'm going to be okay with that, because I will have made so many great decisions to get to that bad decision that, I will have made a decision. It's impossible to be perfect. The interesting thing about decisions, I learned a lot about decision making as an anesthesiologist, because as an anesthesiologist, you're taking care of one patient and you're managing kind of everything for that patient, right? From their breathing to their blood pressure. And you always have to have a million backup plans. But what I will tell you is that when something happens, like if the blood pressure drifts down or the heart rate goes up, the worst thing you can do as an anesthesiologist is not make a decision. It's the worst thing you can do, because not making a decision is absolutely making a decision. And if there are signals that something is going down a path, your inability to make a decision could double down on that path. And then it turns out that you can recover from one decision, one bad decision, two bad decisions, three bad decisions. It's amazing. You can really recover, but it's the constant thinking and moving that keeps you going. I mean, if you think about it, 80% of the decisions that I make would probably be fine either way, whether I make it or not. 20% of them, maybe 25% of them, I'll have to do something to recover if it was the wrong decision. It will be some pain. It won't be horrible, but there'll be something. And then 5% of the time, I'm just kind of stuck down that path. So that tells me that I just need to commit to a path. I need to take what I know and take what I desire for our community and make a decision, and it will be okay.
Thank you so much for sharing that. I really appreciate you explaining about how you can't be perfect and no one can make the decisions that you're going to make because you are, your own unique person, as you said. And if you don't speak up and advocate for those issues that are personal to you, then who will do it? So you have to be confident in yourself and feel comfortable with the choices that you're making. And then on the topic of decision making, as you continue to shape healthcare equity in your role, what are some of the major priorities or initiatives that you would like to advance in medicine? I know that's also a very large question, but any major upcoming initiatives you have for Swedish?
Well, so the two big issues that are going to be coming up are access to healthcare, right? It's just, as more and more of our population ages, it's going to increase the burden on healthcare. There's about 10,000 patients a day that become eligible to sign up for Medicare. What it means is that 10,000 baby boomers are turning 65 every day. So that is going to be a tax on our system. So really, how can we expand access to healthcare? And we can't, there's only so many of us. So it's how do you expand on the delivery system that we have right now? So that's a big focus. Like, how do we talk about virtual medicine? How do we talk about support for our clinicians in delivering care, whether it's personnel support, like providers that come in and support, like nurse practitioners or physician assistants that come in and support, or whether it's AI that supports by taking away some of the cognitive burden. So those are things we're thinking about for access to care. And then when I think about primary care, there's a couple things that I think about in primary care. The first is behavioral health. So behavioral health is for some reason, it's carved out as something different than the rest of your health, right? Then you're, managing your blood pressure. For some reason, your mental health is not in the same category, and it's not funded in the same way, meaning your insurance companies don't pay for therapists in the way that they pay for blood pressure medication, even though it's proven to be effective for dealing with depression. So it's really, I spent my years as a nurse, my 5 years in nursing was spent in behavioral health nursing. So I have a passion around how do we maintain our mental health as in addition to our physical health. And I also think COVID maybe made America a little bit more aware of mental health and how that plays a role in your health. And I also think your ability to be a contributing member of society. So our goals are around how do we make sure that every single one of our primary care practices have a behavioral health provider in those practices, so that if you come in and we do an assessment screen on you and we find out that you are feeling depressed, or you are, maybe feeling challenged, then we're able to find a way to connect you with somebody to be able to help you with that. So that's a big part of the work that we're doing. And then another part of the work that we're doing is really around health disparities. And it's easy to say, well, I want to be able to solve some of the inequities in health, but nothing is solved unless it's on our sheet for our goals. So at the end of the year, we look at our goals and we can say we achieved this. So it's really important to me that there is a health equity goal for our clinics. And so our health equity goal is really around blood pressure for Blacks, because if you look at blood pressure globally, Blacks have a higher blood pressure than all others, and they're disproportionately affected. And so what that means is that other demographics do better. And so what we've done is we've kind of focused on that, and we've looked at all of our patients that identify as Black, and all of them that have a high blood pressure diagnosis. We make sure that when they come in, their blood pressure is tested, and if their blood pressure is high, that they're referred to a clinical pharmacist who then follows up with them, make sure they get med refills, make sure they come back for an appointment, make sure they come back and get retested. So it's this kind of double down focus on that population to make sure that Blacks, their demographics are equivalent, their rates are equivalent to all the other demographic groups. So that's one of our goals that we have.
That's so awesome. And yeah, I realized too, and it's something that we know, but other people in the community don't know, unfortunately, that there are so many disparities when it comes to Black Americans and African Americans in our health. And that was especially clear during the COVID-19 pandemic. It's just, can you speak to that a little more and why you think that is and what systemic factors might play into those disparate health outcomes?
I spoke a little bit about that when I was speaking to maternal health outcomes. And so it is the same. They are the same. The same issues that affect maternal health outcomes are the same issues that affect the general population. It's really about access to education and therefore access to income. And then it's about systemic discrimination. So both of those issues play a huge role. And it's ironic that healthcare only owns, a component of it, but a large component of it is really, how do we, make choices in America about educating our children, about prioritizing education. I think fundamentally, those are the things that need to change to get us to a place where we're not seeing discrepancies in how healthcare is delivered.
Right, I definitely see that point because, like you said, a lot of times education is tied. It's not about the education, but it's tied to income. And when Black people live in neighborhoods that have food deserts, they don't have access to healthy foods. They don't have the income to buy organic foods and things like that, and they're eating what they can afford is all processed things. That's obviously going to result in adverse health effects. So thank you so much for elaborating on that.
Yeah, I really appreciate the points that you brought up about those systemic barriers and creating a strong foundation for people to be able to thrive and have their basic needs met. And I also appreciated that you spoke about the issue of mental health and how our healthcare system has not prioritized that specifically for our community that seems to have a stigma surrounding just even confronting like mental health disorders or actually recognizing that, it's okay to ask for help. So I appreciate that you brought that up. And I have two questions. One short question would be for those aspiring Black doctors that are worried about some of those systemic barriers to attending medical school when it comes to finances and managing like their life responsibilities and maybe being the first in their family to even attend college. What would that piece of advice be for them?
I would say stick with it. It's worth it. It's worth it in the end. It is worth it in the end. And there are many resources around you that you may or may not realize are there. So look for them. Sometimes they're hidden. But I would say any setting, any community will have some place for you to get support through that path because it is very difficult. But as painful and as challenging as it is, I've never regretted going down that path, and I wouldn't change it for anything. So if you're on that path, you should absolutely keep going. Know that there are many of us that support you, and reach out if you need any help, because I know that all the other Black physicians if they found out you were struggling, or if they found out that you just, needed somebody to talk to, would be more than willing to step in and fulfill that role of mentorship for you.
That's amazing. Thank you for talking about community. And I'm sure that will resonate with so many of our listeners, because it is so important to have people that you can lean on and that can guide you in those times of adversity. And our last question for you, I know we went over time as we always do, but we ask all of our guests this question when it comes to what Blackness means to all of us and how we continue to move through our lives based on our identity, and also just orient ourselves around the diaspora. So if you would be able to answer this question, what does Blackness mean to you?
It's actually a hard question.
It is
because you're born Black. It's not like you have experienced or are able to experience anything other than being Black. But I would say what I appreciate and love about being Black is the instant community. So I believe that we're all connected to one another, regardless of skin color. But the special thing about being Black is it's incredibly visible. You can see it a mile away. It's, you can see it in a crowded room. And while other people may be connected, by religion, by alma mater, by, even family, it actually takes a conversation to realize that you're connected, right? But we don't have that problem. Like, we know 100% when you walk in the room, for a majority, there's some Black people who it's not visible. But a majority, that you have run into another Black person. And I love that connection. And I think that, when I think about that, it's that and the fact that we recognize each other. Like, I think that's super cool. And, certainly done it my whole life. Even when I'm walking through the hospital and, I see somebody else who's Black, like it's the nod. Like, it's really you see them and you have this instant solidarity with them that is immediate. It's always a bit of surprise when you find yourself in a room of every other person other than a Black person. When another Black person walks in, you always see them, you always, make eye contact. It's an instinctive, support and acknowledgement of somebody who's living in the same skin that you are. And I don't know, it's pretty special. It's like you have somebody in your corner in every room. And I don't know, I don't think that others get to have that camaraderie, like that immediate experience, shared experience. And so that's pretty special. It's pretty special in a world where I think human connection is becoming more and more difficult.
Absolutely. It's something that you just feel in the soul, that the special connection that we have and that camaraderie, like you said. And thank you so much for joining us today. I know we went over time, so I know you said you had a 9 o'clock, so thank you for spending extra time with us. And I just wanted to ask you if there's anything that wasn't brought up, or any piece of advice or any gems that you would like to add based on anything we discussed before we wrap up today.
Oh, I don't know. I would say, Brad, Tiana, I think you dragged like everything out of me. I have nothing else left to give. So
I guess you did a good job then. That was our goal. Yeah. Perfect. Yeah. Well, thank you again so much for your time and joining us early on a Monday. This is a great way to start our day and week. So we hope you have a great rest of your day and hope to connect soon as well. So thank you so much.
You're so welcome.
All right. Bye.
In touch. Thank you.
We are so grateful for your support, and thank you for listening to Identity Unboxed.
Authenticity is your guide to cast an impact on the world that you will be proud of. Signing off with pride, Tiana
and Brad.
Thank you so much.